So this is a quick video if you're planning on or considering having your biceps tendonitis. So this is a very quick procedure for us. When your biceps tendon goes into the shoulder joint and it inserts on the top of the labrum, and a very common tear we get is called a slap tear. And we used to repair those, 10, 15, 20 years ago, but they had a pretty high failure rate. So what we found is just taking the biceps tendon and anchoring into bone is a very reliable way to solve that problem. So this is just kind of quickly talking about if you're getting an isolated biceps tenodesis, right? It's like no other work done. A lot of times it'll be done with a rotator cuff or, a labral repair, but this is if you're just getting your biceps done. So, what we do is go in with a camera, we take the tendon, anchor it into bone, right? That's the procedure. Afterwards, you can move your arm as much as you want. Honestly, no sling at all. I wouldn't wear it very much at all. You may get some bruising down the arm. Your biceps tendon may look a little different, even if we tenodese it. So it may just ball up just a little bit, just because we are moving that tendon and it can shift it. We try to minimize that, but just know that's possible. We want to keep the lifting less than 10 pounds, especially just out here like this or using your biceps. Stuff down here you can do a little more, but if you pull really hard, you'll pull the tendon out. And even if you do, it's not the end of the world, but it can look different cosmetically. Again, it's a quick outpatient procedure. You can move and use your arm right away. You can drive right away. You can get back to work as soon as you feel comfortable. Working out, lifting weights, again, you want to wait 3 months before heavy stuff, but lighter stuff we'll do before. We'll get you into physical therapy. They'll do some gentle strengthening work. So we don't do a ton of isolated biceps tenodesis, but we do them occasionally. So we wanted to make this quick, short video, just kind of outlining the major questions we get for that. And when we do that in isolation, it's a very reliable procedure for that problem. So, and the anchor we use is made out of PEEK. It's made out of PEEK, which is like a special plastic that goes into the bone.